Welcome to the Documenting Ambulance Transport's Field Operations Specific Compliance Training, Functions of Documentation, Characteristics of Documentation, and Requirements. By the end of this course, you will be able to state the importance of documentation of ambulance transports, list the general compliance requirements, explain the characteristics of documentation, and summarize the Medicare documentation and compliance requirements. It is impossible to place too much emphasis on the importance of factual, thorough, objective, and complete documentation of your patient encounters. Our documentation must keep pace with today's ever-changing requirements to avoid liability, maximize reimbursement, and stay in compliance with numerous laws and regulations. Documentation not only provides an accurate record of the patient encounter, it is also the foundation for accurately billing to the appropriate agency or individual for our services. It is important to remember that as EMS professionals, you know and understand the clinical protocols set by your local authority, and you know when and why you provide certain interventions. However, others may not understand without a detailed explanation. This means it is very important to provide information not only about why a patient is being transported by ambulance, but why you have provided certain interventions. Rural Metro Corporation has developed the specific compliance training for billing and collections personnel as the basis for determining the appropriate method for filing claims and for what to expect related to ambulance crew document requirements for completing the patient care reports, or PCR, and associated documents. This training sets out the minimum requirements of data to completely document patient encounters and to appropriately bill claims. There will be additional local operational, local regulatory, and state regulatory requirements for our documentation. Your PCR should always answer the following questions. Why was the patient being transported by ambulance? What was the patient's condition that required ambulance transportation? Or why would transportation by other means be contraindicated? If you don't know the answer to either of these, ask. Remember, if it was not documented, it was not done. You are a medical professional and have been trained to provide patient care according to the current standards and local protocols. Your patients deserve nothing less than the best. The intention of this guidance is to help you document your patient care and assessment for each transport accurately, completely, thoroughly, and in accordance with Rural Metro's documentation standards. Documentation of ambulance transports serves a number of important functions. Memorializes patient care. Our documentation is the legal and permanent record of the patient's condition and our care during the time we were with the patient. Communicates essential information to the healthcare providers to whom we transfer care. Provides the data for quality improvement activities. Provides the information needed to correctly bill for our services. Provides the data for required governmental reporting. Provides some of the information used to assure our practices are in compliance with federal and state regulations, and provides the data needed in clinical research. In order to fulfill its functions, our documentation must have certain characteristics. We can be confident that documentation is adequate if it contains the following characteristics. Click each checkbox to reveal characteristics of an adequate document. Medicare laws, regulations, and policies administered by the Centers for Medicare and Medicaid Services, CMS, impact healthcare in almost every way. Because Medicare is the largest payer for healthcare, Medicare regulations make the rules and set standards of care and procedures for payment followed by most insurance plans. This is certainly true for ambulance services. Medicare beneficiaries are the largest percentage of our patients. In addition, many other payers use or refer to Medicare as the basis for their own policies and procedures. Because Medicare is a government program supported by U.S. taxpayers, there are significant requirements for healthcare providers and suppliers who want to continue to have Medicare reimburse their services. All of our documentation, from dispatch to PCRs, to our billing documentation and procedures, must comply with Medicare regulations and is subject to audit by Medicare and other federal agencies. Failing to meet Medicare requirements can mean we do not receive full reimbursement for our services. We can also be fined by Medicare for deficient documentation. Rural Metro employees are strictly prohibited from documenting patient conditions that did not exist and documenting interventions or services that were not actually provided. There are 6 major Medicare regulations that have significant relevance to dispatchers and field crews documentation. Roll over a button to view each major Medicare regulation. Match the regulation to the correct description. Drag and drop the green ball to the appropriate location. Match the regulation to the correct description. Drag and drop the green ball to the appropriate location. You have completed the introduction and the lesson on Medicare, documentation, and compliance. Remember, each transport should be clearly and accurately documented, explaining why the patient is being transported and why the ambulance transport was necessary. At no time should any rural Metro employee falsify documentation regarding a patient's condition or the services provided. Documentation of ambulance transports memorializes patient care, communicates essential information to other healthcare providers, provides data for quality improvement, billing, governmental reporting, and clinical research, and provides some of the information used to assure our practices are in compliance with federal and state regulations. Documentation must be factual, complete, accurate, detailed, and legible. Your documentation must conform to that provided by others at the same skill level and must meet compliance requirements. Medicare impacts almost every aspect of healthcare, including documentation requirements. There are 6 Medicare regulations that have significant relevance to dispatchers and field crews documentation: medical necessity, service levels, condition codes, patient and crew signatures, and legibility. Congratulations! You have completed specific compliance training, functions of documentation, characteristics of documentation, and requirements.